Hello, it's me again, Daryl, Florida Catholic guy. Just had my doctor's appointment today, and she's chasing bugs around. uh, that was a good jump. That'll get her some exercise. Oh, here she goes, taking a, looks like a pee.
We're going to be available from Tampa General. We're going to go out of service for decon and also returning to the firefighter station one with us.
So
1109 Winthrop Market Street.
basically, the best thing about it was I got a continuous blood glucose monitor, which is something I've been wanting for years. And the VA's criteria didn't allow me to, for whatever reason. But now they changed their criteria, so I met the whatever qualifications they have to be able to get one. So I just got it today. And the only issue with it is they're not as accurate as a finger stick. And like for instance, when I got home, for whatever reason, my blood sugar was really high. It was like 318. But with the finger stick, it was like 264. So that's a big discrepancy. I mean, I don't know if it's going to take some time to, get calibrated or whatever. But I'm going to keep an eye on it. Looks like we got a, I don't know if you could see it on the screen, but there was a monarch butterfly. I saw it yesterday too. That's pretty cool. But so basically it's, I mean, I wouldn't use it for accuracy. I think for accuracy, I'd stick with the finger stick for now. But what it will show is how different foods either don't affect or spike my blood sugar. So I know what I can and can't have, what I should stay away from, which I pretty much know anyway. But, even stuff like, certain spices can spike your blood sugar, and without knowing it, it's like I just had some microwavable bacon and sausage, which isn't the best. I mean, if you're gonna get bacon and sausage, you should get the real thing and not the microwavable Jimmy Dean's crap or whatever brand of bacon was. I mean, it's just as easy to stick bacon in the air fryer for whatever 10-15 minutes that it is the microwave for 3 minutes. So, just from now on, I'm just going to get the real stuff, Plus, the microwavable stuff, the frozen stuff, they put all kinds of preservatives and stuff, and a lot of that has sugar in it. So I usually get the, for the regular bacon, I usually get like the uncured, just regular thick cut bacon, and which is much better than any of that microwavable crap. So, in fact, I'm probably going to throw the rest of the microwavable crap away because last few times I've had it, I've ended up getting diarrhea afterwards, and
Thank you.
I don't know if it's past the expiration date or just my body's rejecting it or what, but it's terrible. I mean, it tastes all right, but the side effects is what I don't want. And I don't get that with regular bacon. So,
Rescue 37. Respond to unconscious fainting initial response. 1:11:55. Winthrop Market Street.
so at least I got the continuous
Cross
blood
streets are Winthrop Town
blood
Center Avenue and
glucose
Providence Road.
monitoring thing. So I'll be able to,
Kilo 14, 10, 14, 20.
you know, see, like I said, see how different foods affect me and what to stay away from, and you know,
1600 pounds.
make sure there's no surprise that something that I think is okay and it's actually secretly raising my blood sugar, which that's possible, but
4813.
you just had a quick shower here. It was
Resource 412 and 1 Juliet 12 on over channel.
I had to go to the bank, so I brought brought Princess along with me for the ride.
Source 412 and 1 Juliet 12.
She kind of was anxious in the car. I mean, she did all right, but she seemed anxious. She's laying down in the grass there, so I guess I can turn this around. I don't like this because I can't see
Right, you on channel?
I can't see what the picture looks like to see if I'm in focus or not in focus or whatever.
Hey, is your car the
But
car that
anyway,
you have? Or 16?
the doctor wanted to put me on. Well, she wanted to put me on cholesterol medicine, which I don't need because my good cholesterol, the
X-ray Charlie Lima 3.
what is it, the
MXCL38.
HCL or something like that, whatever it's called. They call it the good cholesterol. That's within normal limits. And from listening to Dr. Barry, the overall cholesterol and the so-called quote-unquote bad cholesterol don't mean anything. What you want to look at is your good cholesterol and your triglycerides. Now, unfortunately, they didn't do the triglycerides in my latest labs, but I'm going to have them done again, I think, in either, forget whether it's 3 or 6 months, and she's going to do the triglycerides then, so I can see she wanted to put me on a whole bunch of supplements, vitamin supplements, because like vitamin D I was low in, vitamin B something I was low in, and there was others. And I agreed to that because, I mean, supplements, I mean, they're not gonna hurt you at all, you know, so I'll take the supplements. That's, you know, that's no problem with me with that. There was something else that was either high or low that she wanted to put me on Lipitor, which is a blood pressure medicine, but it wasn't for blood pressure because my blood pressure was perfect. My blood pressure was 118/70, which surprised me because earlier this week last week when I took it, I was running the 140s, and all of a sudden today I'm 118/70. So the walking and everything I'm doing, the exercising I'm doing is working. So got to keep that up. So I refused that for now. I told her that, you know, when we redo the blood work, we can, hey, get out of there. Hey, get out of there. When we redo the blood work, I says, then we can see what it is and we can talk about it then. But, you know, I don't want to go on medicines that I don't need that's, you know, they're going to put me on something that's going to lower my already perfect blood pressure. They're going to do, they're going to test, they had me do another urine sample today because of the possible UTI that I might have. They're also going to put me in for an x-ray on my hand. I don't know if I told you about, but I have a trigger finger. So they got to do a x-ray before they refer you to the hand specialist. And I got a couple of cysts, one on my back, and I don't know if I talked about that before, but that one's really bothering me because it bleeds a lot, and like all my t-shirts have blood stains on them, so you know, I want to make sure it's nothing that's skin cancer or anything. And I have another one on my my right thigh that they're going to look at, so put in referrals for that. So I need to get my eyes checked because I haven't had them done in, well, since I lived in Maine, so it's probably been 7-8 years, and I'm supposed to have my eyes checked every year, so I got to make the call for that. And I want to make a call for to get my dental cleaning and checked and everything, so. But other than that, the doctor, I liked her. She's a big heavy set lady, which, you know, a lot of, last doctor I had was a heavy set guy. She's a black lady, nice lady. I mean, nice doctor. You know, when the stuff that I didn't want to get done, she respected it. She didn't, you know, overly try to push me. You know, the last doctor I went to, I can't say that he yelled at me, but he was really pushy on, I think that was the doctor that, because I think it was still when COVID was really going on. And they still wanted everybody to mask up, and I didn't want to do it. And he told me he wouldn't see me if I didn't put on 2 masks. And I told him, I says, I'm not going to put on 2 masks. And then he says, well, I'm not going to see you. I says, well, you want to do the phone interview, schedule a phone interview? Because I'm not putting on, I had a 1 mask that I agreed to wear, but he wanted me to put another one on because it wasn't a surgical mask that he liked or whatever, and then he started in on you know, wanted me to put on this medicine, that medicine, and get this shot and that shot, and of course he was pushing the COVID shot, and so I didn't like the last doctor I had, but this one here, she's really good. I liked her, and the nurse was good too. You know, because there's a couple shots that they want me to take, like the one you get when you get a nail into your foot, whatever that's called. In theory, I got no problem with that, but then they wanted me to get well, of course, the flu vaccine. They wanted me to get a pneumonia vaccine. They wanted to give me shingles vaccine, and I turned them down on all that. So the one for when you stub your foot, or not stub your foot, but when you get a nail through your foot, I can't think of the name. It's right on the tip of my tongue, but whatever it is, she said if something happens and you do get a nail through your foot, you can get that shot, tetanus shot. That's what it was. She said you can get a tetanus shot when they're treating you for that. So, because it's been more than 10 years, I guess. So. I don't know if it has. It might be close to 10 years that I had it, but I've had that before, so I know I definitely had one in Maine, because I had all the round of shots and everything they give you when I worked at Maine Medical Center, because I mean, obviously working in healthcare, you want to, keep up with most of your immunizations anyway. But, other than that, my A1C isn't good, but that's not surprising since, I'm only about a month into my diet. Hate calling it a diet because it's really a way of life. The carnivore, quote-unquote, diet. I mean, because if you start having cheat days and stuff, you're going to go off it like I did for a few years, and you're going to lose all the progress you make. So it's really a way of life, as opposed to a diet. And so I've only been doing it for about a month, and the walking, I've only had my dog for maybe a week and a half, 2 weeks. I think it's 2 weeks this Thursday, so I only started walking when I got her, so it's going to take a while to, there's certain things, obviously, my blood pressure has gone down, my blood sugar is still a work in progress, but it is going down. I don't, it says I was in the 300s, but I don't think I was in the 300s this morning, because like I said, when I did the finger stick, I was in the 260s, which isn't good, but it's better than 300. So, keep my walking up, keep eating what I'm supposed to be eating, and, just, doing and things I think will fall into where they should be. I mean, I let myself go for, I think the last time I was on, paying attention to my diet and eating better was, 3 years ago, something like that. And ever since then, I just ate anything I wanted: donuts, cakes, pies, cookies, potato chips, whatever I wanted, Didn't care about I checked my numbers, but, 400-500 blood sugar. Oh well, take some insulin. And eventually that's going to come back to bite you, because, you might not feel much short term, but long term it's going to hurt you. So.
Call unit 10.3 Griffin 0122 alert out of this 5 3. I-70
45 northbound at the 301 entrance ramp. The dark colored minivan refers lanes on the ramp going into opposing traffic.
I mean, there's obviously things I gotta work on, but overall, I'm
11913, Bakery Drive.
pretty happy with how the doctor's appointment went. So,
Around the south shore of
that's a good thing.
Copy, thank you.
Not much news the last couple days that I've heard. I mean, there's irregular drone attacks in Russia and Ukraine, and
Rescue 7.
well, I guess the biggest thing now is Israel is
ETA for that.
pounding the heck out of Gaza. I guess last night Gaza was on fire, Gaza City,
228.
and
Traumatic
there's
injury.
tanks in the middle of Gaza City, Israeli tanks,
Cross streets are DeSoto Street and
and
McKinney Avenue.
ETA 8 minutes.
Yeah.
I guess
Respond to
Hamas
unconscious
is
fainting. 11913.
taking
Bakery
the
Drive.
hostages
Cross
and bringing
streets are
them
Adeline Drive and Rose Lane.
out of the tunnels and using them as human shields. So Trump threatened them about that. But Hamas doesn't care, you know. And
EDC, engine 46.
Israel isn't doing themselves any favors either by,
Can you place the engine on that medical
you know, doing what they're doing.
EDC to truck 28.
But not much other than that. I mean, still investigating the Charlie Kirk thing, and the biggest thing I'd like to see is, and I guess they're doing it, is arresting the people that are
Unconscious fainting.
threatening to
11913. Bakery Drive. Cross streets are
do
Adeline
harm on
Drive and Rose
other
Lane.
conservatives. And
1430 North US Highway 41.
I mean, social media is just a cesspool out there right now, especially with the liberals. But just so disgusted with it, you know. But anyway, I just wanted to give that update, mostly a health update today. And I'll say have a good day. God bless you. Thanks for watching, and I'll see you in the next one. Bye.